So hello friends, this side Dr. Sonu Panwar, your microbiology faculty at DocTutorials. So today we are going to discuss regarding some very important questions. In and around them we'll discuss. As such, they are not very difficult ones, but the hello friends, this side Dr. Sonu Panwar, your microbiology faculty. We'll discuss the important aspects about every choice, and this will be a high yield session. Hi Anuj, how are you? Hi SS. So we'll be there in the live chat also. We'll be discussing up. Good evening, Indu. So we'll discuss important points regarding every particular choice also here. And you try to be interactive. And if at all something is wrong, later on it should not be wrong. That is what is the main aim. Okay. So let's start up. This particular session is good for, obviously, it is more focused on the NEET and it's equally good for the FMG fellows also. Now, yes, tell me what is the answer? Hi Deepak, how are you? What is the answer to the first question? Which statement is not true regarding the melioidosis? Yes, what's your answer? A, B, C, or D? Yes, tell. Which is the answer of yours? Anuj have told D. Sham have told D. CNS manifestations are not present. Okay. D you have told. Is it fine? Anybody else wants to try for this? SS also told D. So answer to this question is very rightly D only. That CNS manifestations are present. It is not so. And recently, like I have shared up also on my Instagram channel, so there was a case with the like saline infusions which were infected up with this Burkholderia pseudomonas, and it caused up around 8 to 10 deaths in the Tamil Nadu in 2023. So definitely the CNS manifestations are there in this particular Burkholderia pseudomonas infection. Mostly it is Pseudomonas. P. Pulmonary infections are common, that is pneumonia and all. It is found to be resistant to various drugs like polymyxin B, even to the aminoglycosides. Okay. Aminoglycosides, even to the quinones. It is intrinsically resistant to them. Okay. Not exactly to the polymyxin B, it is intrinsically resistant, but to these particular ones, aminoglycosides, quinones, it is intrinsically resistant to them. So that also, Acha, you have seen that case. Fine. So remember this, that it have an intrinsic property to be resistant. The causative organism I told you, Burkholderia pseudomonas. Okay. Pulmonary infections are common, P for P, that is pneumonia-like. And CNS manifestations are also present. And where this organism is present, it is there in the soil. It can be that type of thing. And if infection happens from it, then there is a problem. Okay. Then there is a problem. Besides all this, what you need to know that in my notes and all, where you heard this name, Burkholderia pseudomonas. So Burkholderia pseudomonas is an organism which is bipolar stained. Okay, which sort of organism it is? It is bipolar stained, and bipolar stain means having a safety pin appearance. Okay, it is having a safety pin appearance. The melioidosis, this particular one, is being done by this Burkholder pseudomonas. And important is it was used by America in the bioterrorism, also termed as Whitmore's bacillus. Okay. And there is a media for this that is termed as Ashdown media. The culture media for this is what, guys? That is Ashdown media. So this particular one is termed as Whitmore's bacillus. It is termed as Vietnam bomb. It was used by the America in the Vietnam warfare. Okay. Along with that, you should know the other name is Whitmore's bacillus, and the culture media is what? Ashdown's media. Okay. And all particular things they can be asked. And one of the things which I seen up in one of the INICT questions, that Burkholder pseudomeli is motile or non-motile. So remember, this particular one is motile. Okay. And if you have attended my lecture, you must be knowing up that we have learned this in this fashion, that there is another fellow, Burkholderia malai. And Burkholder malai, this is doing up a disease termed as what? Glander's disease. This particular one is doing which particular disease? Glander's disease. And this particular Glander's disease is a disease of horse. Okay. G for Ghoda. And that particular horse mostly dies of this particular disease, that is Glander's disease. And that's why from that we can infer up that Burkholder malai is what, guys? Non-motile. Because that fellow dies now, become non-motile for lifetime. So you remember like this, Burkholder malai is non-motile. And just opposite to that is what? Burkholder pseudomeli, which is motile. Okay, which is motile. Is it fine? So remember these particular points, and they are definitely going to be asked. And this Burkholder malai, this is also having a bipolar safety pin appearance. Okay, this is also having what? Bipolar safety pin appearance, like the Burkholder pseudomeli. Now there is one brother also of them, that is termed as Burkholder capacia. Okay, and Burkholder capacia, this particular one is said to do what, guys? It's said to do the pneumonia in the. It's said to do the pneumonia in the cystic fibrosis patients. In the cystic fibrosis patients, Burkholder capacia lands up with the pneumonia in them. Okay, but remember the question which I've seen once was that sort, that this Burkholder capacia is there, which does. But the most common cause of pneumonia in cystic fibrosis patients is Pseudomonas. Okay. So most common cause, if somebody asks, the most common cause is what? The most common cause of pneumonia in cystic fibrosis patient, okay, is Pseudomonas. This particular one is Pseudomonas. Burkholder capacia also does it. But if somebody asks you that which is the most common cause of pneumonia in cystic fibrosis patient, the answer is Pseudomonas. Is it fine? So this much you should know regarding the first question. Now, coming to the second one. Tell me, a 45-year-old female is there. Okay, this is what is the second question. 45-year-old female is there, presents with headache, nausea, diarrhea, and erythematous blanching rash that is present about 60 minutes after eating the tuna fish. This particular fish is also being mentioned up at a restaurant in Goa. She also complains of pruritus and a restless feeling. Her face became flushed after the meal. Her friend who also ate the tuna had the similar features. What would have been the most probable diagnosis of this particular condition? Okay. Anuj have told what? Pseudo. What pseudo? Anuj have told C. Scombroid food poisoning. Okay. Indu have told C. And Shri Sham also told C. Okay. SS also told as Scombroid fish poisoning or food poisoning. So basically, guys, whenever these particular names comes, like tuna fish and all that, in their intestine and all, certain bacteria are there. Okay. And those particular bacteria are like Morganella, Proteus, E. coli. Okay. And if these particular tuna fishes and all, they are not properly refrigerated and they are being served like that, what will happen? That this particular entity happens. And what is the name? Scombroid fish poisoning. And in this, the similar features like of type 1 hypersensitivity, vasodilatation, and bronchoconstriction, this can happen. Okay, this looks like a type 1 hypersensitivity, but actually remember, this is food poisoning. This is a food poisoning. It mimics the features of that, but it is not a hypersensitivity. It is a food poisoning done by eating of what? Contaminated tuna fish or related members which have these particular organism in them. So actually what happens is that these all like Proteus, these Morgellella, okay, because of the infection which they are lying there and these are not refrigerated properly, there is a production of histamine. Okay, as in the case of type 1 hypersensitivity, this histamine is being produced, and histamine produces this vasodilatation and bronchoconstriction. Is it fine? So that's why this is a like obviously a death scare which these particular fellows they have after having this Scombroid fish poisoning. And main culprit is what? The improper refrigeration. Okay, that is what is the main culprit. So you should know about this particular food poisoning. Sometimes it can be like a death scare. Okay. Now, talking about the Vibrio, that is, you already know that in this massive watery diarrhea happens up. Large amount of bacteria they are needed up. Important regarding Vibrio is the Vibrio cholerae. This particular one secretes up what? The cholera toxin. Okay, and that particular cholera toxin is acting on the jonooccludens or tight junctions. It is having two components, A and B. B helps in binding to what? B helps in binding to the GM1 ganglioside receptors. It binds to what, guys? GM1 ganglioside receptors. One of the NEET PG questions only, this one. Then it binds to which one? GM1, GM2, GM3, GM4. The answer is GM1. How to remember? The general manager of a company is number one position, and it happens to those only. So remember like that. Okay. A does what? A does ADP ribosylation. And ADP ribosylation of what? Of G proteins. Like that is termed as GTP. That is G proteins. And this particular one leads to what? This particular leads to increase adenylate cyclase activity. And this adenylate cyclase activity leads to what? Increase in cyclic AMP. And this increase in cyclic AMP pushes what? Intracellular water into the lumen, and the patient have what? The massive watery diarrhea. Okay, massive watery diarrhea. So definitely the questions will come around this particular one every time. So you should know about this. Okay. As far as the food poisoning due to the preformed toxin is concerned, this happens to be in the case of Staph aureus. And the Staph aureus food poisoning, the most important thing is the incubation period. And the incubation period is around how much it is? That is 1 to 6 hours. How much is there? 1 to 6 hours. And this particular one mostly happens by what? Contaminated meat and milk products. Okay, contaminated meat and milk products. They are there in this particular one, because of which this particular Staph aureus food poisoning happens. This is due to the preformed toxin, and it is a heat stable toxin. Means whatever you do, if this is there, you have to throw the food. Okay, you can't have it. And the various enterotoxins which are there in this, like enterotoxin A to H, they are there. The most common is enterotoxin A. Okay, and this is having an action, and that action is termed as what? Vagomimetic action. That particular action is termed as what? Vagomimetic action. The vagus nerve that is being stimulated in this particular one. Okay. Yes, botulinum can also be a preformed one. You are right. Okay. So that is there in this particular one, which you need to know. Okay, guys. Fine. And this is having a vagomimetic action. Now, if I ask you a question, that name a food poisoning. Okay, most of the food poisonings, what they have the diarrhea and all. But there is one food poisoning which leads to constipation. So can you tell me which particular one is there which leads to food poisoning? Yes, please. Name of food poisoning in which constipation happens here. And that is due to the botulinum toxin. Associates with what? Canned food poisoning, if you remember up. Canned food poisoning. And that particular action of those particular neurotoxins or enterotoxins is what? Anticholinergic at various junctions. Okay. And using the various snare proteins like synaptobravin, syntaxin, SNAP25, these all are being utilized, and there is an anticholinergic action. And because of that anticholinergic action, these particular ones, what they have? They have constipation. Along with what? Dysphagia, dysarthria, diplopia, decreased DTR. All these particular things, they are being observed in this one. Is it fine, guys? So remember all these particular important points regarding the various food poisoning. Definitely one question is from there. Regarding the Staph aureus, another thing which came in the exam is that somebody had a party. Okay. And while they're going out to the party in the late hours, 2, 3 people they have eaten up pastry. And that pastry, after having those particular pastry, 2, 3 people only get food poisoning after several hours. Okay, so that contaminated pastry was there, which was the causal agent of that food poisoning. So that also needs to be remembered that it associates with what? Contaminated milk products. And along with that, potato salads. And these also are there, which leads to the various problems. Okay, so this is regarding the various ones. Now coming to the third one. A 45-year-old patient was provisionally diagnosed with the GBS. Okay. GBS is Guillain-Barré syndrome. Guillain-Barré syndrome is ascending type of paralysis. The stool sample sent to the microbiology lab for the isolation of this particular bacteria. They are already giving in the question the name of the bacteria, Campylobacter jejuni. What should be the culture requirement for this particular bacteria, which is termed as Campylobacter jejuni? So can you tell me, guys, what should be the like the ideal conditions for this particular one? What are the various culture medias for this? Okay. So as you're telling up in the comment section, the answer is A, and very right, the answer is A. The Skyros media, microaerophilic conditions. Microaerophilic conditions means what? They need only 5% oxygen. Okay. But they need this temperature. 42 degrees centigrade is needed for the Campylobacter jejuni to grow best. Okay. And this particular question also comes because most of the medically important bacteria, they love to grow at which temperature? 37. Okay. But this one is there which loves to grow at which one? 42 degrees centigrade. So this is the most important. And how I made you to learn this, that Campylobacter jejuni. Campylobacter jejuni, this is the name, na? Campylobacter jejuni. And this Campylobacter jejuni is, you remember like this, that this is a camp. Which camp? Summer camp. And the summer camp is having which temperature? 42 degrees centigrade. Okay, 42 degrees centigrade. And in this summer camp, the child have played a game of what? Dart. Because it is having which sort of a motility? It is having a darting motility. It is having a darting motility like which particular one? Like Vibrio cholerae. And Vikram is very right that mostly it is the poultry products contaminated. But yes, it can happen with the contaminated water also. And the recent epidemic sort of a thing which happened in Pune was due to the contaminated water. That was due to what? Contaminated water. Is it fine? So this also needs to be remembered. Now, let's see the other options once. Let's see the other options once. As somebody was telling, Zika also associates with GBS. Very right. Zika also associates. And the most probable question which can be other than that, that which other bacteria associates with GBS? Remember the name of Mycoplasma pneumoniae also, guys. Mycoplasma pneumoniae, that is also there, which have a good association with GBS. Okay, which have a fairly good association with GBS, that is Guillain-Barré syndrome. Okay. Now, the second one, the Wilson and Blair media. Wilson and Blair. Can you tell me Wilson and Blair is used for what, guys? Wilson and Blair is used for Salmonella typhi. Okay, which particular organism? Salmonella typhi. That is used for Salmonella typhi. Which one? Wilson and Blair. So this particular Wilson and Blair, Salmonella typhi. Okay. And on this Wilson and Blair media, which sort of colonies they come, guys? On this particular one, what comes? Jet black colonies. Okay. And if you have done the classes, you must be knowing, I told you that this black jet is only with whom? Salman. Okay. This black jet is only with whom? Salman. And in this particular jet, that fellow have gone to meet whom? Wilson and Blair. So this is the best selective media. Actually, this is the best selective media for which particular thing? For the Salmonella typhi. It is the best selective media. Okay. Very right. That is also true, Pooja. That we have a question of that. TCBS media. If somebody talks about the TCBS media, okay. So TCBS full form is what? Thiosulfate, citrate, bile salt, sucrose. That is the full form of TCBS. Thiosulfate, citrate, bile salt, sucrose. Okay. And this was asked in the NEET PG also. Thiosulfate, citrate, bile salt, sucrose. And this is there for which particular organism, guys? It is for the Vibrio cholerae. It is for the Vibrio cholerae. Which color media? It's a green color media. Okay. If the Vibrio cholerae grows onto it, it changes to what? It changes to yellow. Okay. And why it becomes yellow? Because sucrose is fermented. Okay. And if somebody by chance asks up that which is the indicator used in this, so that is bromothiamol blue. Okay. That changes to yellow. This particular green color media, when the Vibrio cholerae ferments which particular sugar, guys? This particular, that is sucrose. So green to yellow. Okay. Yellow, yellow, dirty fellow. Remember for them, the green have become dirty because of cholera. Okay. Thiosulfate, citrate, bile salt, sucrose. Now, guys, can you tell me? Yes, in the comment section, you tell Campylobacter media. Tell me about this. Campylobacter media is used for that. Let's see how many answers this. The Campylobacter media is used for which particular organism? Campylobacter media. Yes, let's see. Now nobody answered, huh? Khyati Demore, Pooja, SS. Tell me. Campylobacter media. Campylobacter media, guys, is also for Campylobacter. Okay. And those medias which are for Campylobacter, they are also for the Helicobacter. Remember this also. They are also for the Helicobacter. So Campylobacter jejuni media is Campylobacter. Okay. Along with that, you have this also, Buzzler. So Buzzlers, Kiro, Campylobacter. These all are charcoal-based medias. And this question came in the exam. Charcoal-based medias are used for. So remember, it is used for Campylobacter jejuni, Helicobacter pylori, both. Okay. These both medias, well, these all medias are used for both these organisms, Campylobacter jejuni and H. pylori, Helicobacter pylori. Okay. So all these are very important things. You should know about them. Do revise once. Now coming to this particular question. A 50-year-old farmer is there, diagnosed up with the osteomyelitis. Blood culture was positive and subculture on the blood agar showed the growth of a beta hemolytic golden yellow pigmented bacteria. So obviously, you know that which particular one does the osteomyelitis and what is we are talking about here. Because golden yellow pigmented colonies, beta hemolytic, osteomyelitis most common cause, you all know. Okay. So AST was done with the following results that it is coming oxacillin resistant, cefazolin sensitive, clindamycin sensitive, cotrimoxazole also sensitive, vancomycin sensitive, and erythromycin sensitive. Okay, these all are coming sensitive, but oxacillin resistant is there, and they have given up the cefazolin as sensitive. That microbiologists have reported up cefazolin is also sensitive. Okay, so what is your answer, guys? First of all, you tell me this in the comment section. What do you think is the answer here? Tell me. C. SS have told, Indu have told C, And Shri Sham also told C. Pooja also told C, and a C is what is the answer. The cefazolin result should be changed to resistant since it is oxacillin resistant. Since it is oxacillin resistant. And this particular one, obviously, they are talking about what, guys? MRSA. Okay, they are talking about what? MRSA, that is methicillin resistant staph aureus. Methicillin is an unstable drug. That's why we focus upon the oxacillin. Oxacillin is coming resistant, and this is one of the tests also to find out the MRSA. And if I ask you here, can you tell me which other test we do for this particular one that is better than the oxacillin even? Can you tell me in the comment section for the MRSA, which other drug screening test is being done? Yes. So that is cefoxitin, guys. That is cefoxitin screening test. This is better than the oxacillin one. Okay. Obviously, cefazolin, which is first generation, this should also be changed to what, resistant if the oxacillin is coming resistant. And the better one, better test to detect the MRSA, I'm telling up, then the oxacillin one is which one? That is the cefoxitin screening test. Important is that this particular antibiotic testing, AST testing, is also done on the MHA, that is Muller-Hinton agar. By which particular method, guys? KBDDT. What is KBDDT? Kirby-Boyer disk diffusion test. And in this MHA plate, in this particular MHA plate, what you add upon? In this, you add 4% NaCl. And if you are suspecting, like the cases of osteomyelitis, and it is like blood culture is positive and all these results are coming, the incubation of this particular sample should be below 37. Okay, below 37 degree, and that is preferable one is 30 to 35 degrees centigrade. This should be the temperature if you want to diagnose of what? If you want to diagnose of the MRSA, that is methicillin resistant staph aureus. And the main cause is PBP changes to what? PBP2A. Penicillin binding proteins changes to what? Penicillin binding protein 2A. How does it do that? Because of the MACA gene. Okay, MACA gene they have acquired from somebody. This is the main cause. Other ones are production of beta lactamases, which destroy the beta lactam ring. That is also there. Okay. Now, coming to the next one. 38-year-old rice farmer from the UP presented with history of high-grade fever for 7 days, altered sensorium for 2 days. Okay. On examination had conjunctival hemorrhage and jaundice. The urgent investigation shows hemoglobin of 11, serum bilirubin of 8, urea of 78. Peripheral blood smear was negative for the malarial parasite, and the blood culture is also found to be negative here. What is the most likely diagnosis based on this picture of the eyes? Okay, this picture of the eyes. Can you tell me what is the most probable answer as per you in this particular regard? Yes, please. The answer is B. It is Weil's disease. It is Weil's disease, and this particular thing is termed as what? Icterohemorrhagic fever. Icterohemorrhagic fever. And this particular conjunctival hemorrhage is having a special name that is termed as conjunctival suffusion. And conjunctival suffusion is what, guys? Conjunctival suffusion is, that is the red eyes without the inflammatory exudates. Red eyes without the inflammatory exudates. And icterus, jaundice, hemorrhagic features are there. And if you do not handle the things in time, the patients will land up in what? Renal failure, and death can also happen in this particular Weil's disease. So Weil's disease is important, as somebody is telling up the various things regarding it. That is the investigation of choice is no doubt the PCR. Okay, nowadays we go for the PCR for the leptospirosis. Okay, but definitely we can culture it also. And that sounds a gold standard one, because if you can culture something, obviously that is what is the causative agent. And the culture of this can be done on EMJH media, okay, Fletcher media, and Korthoff media. These are the various culture medias on which you can culture that. Okay. A very right assess. There is a Danger's ring also observed in this particular culture one. And the extra point which I like to tell you is there is a criteria name based on the clinical, based on the microbiological, epidemiological criteria that is termed as Fain's criteria. So this question can come that Fain's criteria is for what? The Fain's criteria is for leptospirosis. Okay, Fain's criteria is for what, guys? It is for the leptospirosis. So remember these all important things. MAT is microscopic agglutination test, and it is best serological test. It is termed as what, guys? It is best serological test. And important here, which I like to tell is one is micro and one is macro, and both are what? Agglutination test. Micro and macro agglutination test. Which one is better? Micro one. Micro agglutination test is better than the macro agglutination test. Okay. Now, the drug of choice was asked in your NEET PG. The drug of choice for this is doxycycline. And if it is a severe leptospirosis, then you have to go for injectables, and that is penicillin. Okay, that is given up. So severe leptospirosis, penicillin. Otherwise, the drug of choice is doxy. The leptospira is a spirochete which is having the hooked ends. Important is hooked ends. Which microscopy can be done? That is the dark ground microscopy. Because for the spirochetes, what we do? The dark ground microscopy. Is it fine? So all these important points you should know about Weil's disease. Okay. For the brucellosis, guys, for the brucellosis, if I ask you which serological test is done, this was asked in your exam, and the answer is SAT. That is standard agglutination test. Standard agglutination test. This is the best serological test for the acute brucellosis. Okay. As such, we go for the blood culture. And in the blood culture bottle, we add from our side a particular thing termed as erythritol. And this erythritol stimulates the growth of the brucella. This can also be asked. Okay, there is a special phage typing done for this, which is termed as Tbilisi phage typing for the brucellosis. B for B, you remember up that in this bone pains happens, and mostly which bones are involved? Spine. And in that regard, it mimics what? It mimics TB. In that particular regard, it mimics what? It mimics TB. Okay, and Pooja is right. Like, what is the ratio of the blood and the culture fluid? 1:5. And in that blood culture bottle, what you add from your side? Erythritol. Erythritol stimulate the growth of brucella. Okay, and what is the drug of choice for the brucella also? Brucellosis, guys? That is doxy. Doxycycline is the drug of choice for brucellosis. And the question which came in your exam is this: in this particular SAT, which particular phenomena happens? And the answer is prozone phenomenon. Which particular phenomena happens in the SAT? Prozone phenomenon. Prozone is antigen or antibody axis. This is antibody axis. This particular thing is what, guys? This is antibody axis. Okay, antibody axis is prozone phenomena. Post zone is what, guys? Antigen axis. So remember, one, other is opposite of it. Okay. Q fever. Q fever is done by Coxiella burnetii. Okay, Q fever is done by what? That is done by Coxiella burnetii. And this particular Coxiella burnetii, which is there, later on they got to know that this organism is doing this particular one. And Coxiella burnetii used to be there in the rickettsia, but because it is having no rash, and along with that, there is no arthropod transmission also, because the transmission of this happens through aerosols. Okay. So this particular one is slightly away from the rickettsial family. Associates with what? Cattle rearing, cattle birth. Like question can come in this fashion that somebody attended a cattle birth, and in that the placenta was exposed. In the placenta, this particular tissue might be there. This particular organism might be there, and through aerosols, it can do the infection to the patients in and around them, like farmers who are attending that particular one, and thereby leads to pneumonia, and that is what is termed as cochlear burnet leads to atypical type of pneumonia. Okay, atypical type of pneumonia, and as Pooja telling that it is being killed by the flash method of pasteurization. Very right, she is. It is being killed by what? Flash method of pasteurization. That is 72 for certain time, that is 15 to 20 seconds, and immediately bringing to what? 13. So that is what is termed as flash method of pasteurization. Okay, Q fever. And here also you can use doxy. Here also you can use what? The drug doxy. Doxy is boss in number of conditions. Okay, guys. So now coming to this, a 35-year-old firefighter patient presented with 55% burns on his hands and legs. There was a green colored pus discharged from the burn wounds as shown in the given image. What would have been the probable causative agents of this particular one? Okay, the color of this because of the PPD have changed to something else, but actually what it is? Green colored pus. So what should be the answer of yours, guys, in this? Can you tell what should be the answer of this particular condition? Please tell. C. Pseudomonas aeruginosa. Okay, Pseudomonas aeruginosa is the most common species of Pseudomonas which produce bluish green color type of pigment, that is pyocyanin, and along with that you can say pyoverdin also. Okay, so that is important. First thing, Pseudomonas aeruginosa, this particular organism is one of the causal agent of burn wound infections. But here also one particular thing, if somebody asks you most common cause, that is Staph aureus. Okay, that is Staph aureus, but yes, in the burn wounds the Pseudomonas also does, and here the thing which clings towards that is green colored pus that is being produced by the Pseudomonas aeruginosa only. Another important thing is they can give up this thing here, guys, catalase and oxidase positive. Okay, this particular organism is found to be catalase and oxidase positive, whereas the staph is catalase positive or oxidase negative. Okay, so that is also one of the points. Along with that, this particular Pseudomonas is capable of growing in certain disinfectant agar, like citramide agar. In fact, that is the best selecting media for that. It leads to various ailments like Shanghai fever, malignant otitis externa, which is not a malignancy, swimmer's ear, okay? Then green nail syndrome, osteomyelitis, endocarditis, burn wound infections, all they are being done by what? Pseudomonas. I've told you it does most common cause of pneumonia in this particular cystic fibrosis patient is also Pseudomonas. But it have a problem. Problem is what? The problem is it is resistant type bacteria. It gains resistance very fast. Okay. And like we have done research also on this, that most of the drugs which are available, like imipenem, meropenem, even the higher end drugs, to them also in certain hospitals, the resistance of Pseudomonas is being reported. So it's a sort of a super bug. Okay, remember that it is sort of a super bug which is found to be resistant even to the high end antibiotics. Only polymyxin B now I can say is the only drug against which no resistance is being reported against the Pseudomonas. So remember that thing also. The drug of choice for this particular one is a whole list which you can use up. But important to know is ceftriaxone and vancomycin. These two drugs, they do not act. Important two drugs, they do not act against Pseudomonas. Okay, and as Pooja is telling that there is a media termed as not Kingela media, it is King's media. King's media is being used for the pigments. Okay, so that is also there. As such, the best selective media is what? Citramide agar, and the King's media is used for this particular Pseudomonas aeruginosa for the pigments. Now, guys, this name, Serratia marcens, this particular name, Serratia marcens, is producing up the pigment, okay, pink color pigment that is termed as proteogesin. And this is producing what? Pigmented colonies. Serratia produces a pinkish pigmented colonies, and this is a Enterobacter member. Okay, so if this name comes, so then you should know that it is like pigmented one. They can give you a picture also of that. So you should know Serratia produces pigments. Staph aureus. Staph aureus, the best selective media, pinkish to reddish one. Okay, so that is there. This particular Staph aureus produces what? MSA. This is the culture media of it, MSA, mannitol salt agar. Mannitol salt agar is the best selective media of Staph aureus. Very right, pseudohemoptysis. That is being turned for this Serratia. Okay. Now, can you tell me in the comment section that there is one particular instrument in which it behaves like a biological indicator? Can you tell me? It is a biological indicator, Serratia marcens, for which particular thing? Let's see, you know this or not. This is for that filtration, guys. Remember, it acts as a biological indicator for what? Filtration, Serratia marcens. And along with Serratia marcens, there is one more thing that is termed as Brevundiminas dimonata, and it produces pigmenting colonies, mostly red, and it can be other way around also. Okay. So remember all these particular stuffs regarding the regarding this particular serratia. Staph aureus, the best selectivity you should know, that is mannitol salt agar, and as you know that Ludlam's media can also be used, and number of others are there like milk agar, nutrient agar, and all that. Prevotella, this particular name associates with bacterial vaginosis, guys, and this Prevotella is termed as obligate anaerobe. This particular Prevotella is termed as what? It is termed as obligate anaerobe. Okay, it is termed as obligate anaerobe. Okay, so these all we have discussed. Now coming to this, a 35-year-old farmer got himself stung by a bee while walking in his fields, developed anaphylaxis within few minutes. All are mediators of that except. What is the answer of yours for this particular question? Histamine, heparin, serotonin, eosinophilic chemotactic factor, prostaglandins, CRP. Yes, please. And what we are talking about in this? Is it sort of a hypersensitivity? What happened or what? Can you tell me, guys? Yes. Okay. So answer is like educate me is telling up D. And very right, that fellow is. The answer is D. CRP is not there. Histamine is there. Serotonin is there. Eosinophilic chemotactic factor is there. Neutrophilic chemotactic factor is there. Prostaglandins are there. Okay. All those particular ones are there, which you need to know, except this particular CRP stuff. The answer is D. And we are talking about which hypersensitivity, guys? Type 1 hypersensitivity. Okay, and in this, sensitization and effector phases, two phases are there. The similar phases there in type 4 also. This happens immediately. That takes time. That is termed as delayed type of hypersensitivity. So I give you something that from which the question can come. Type 1 hypersensitivity. Which particular helper cells are mostly involved, which are modified CD4 T cells only, that is T helper 2 cells, and there is a release of a particular interleukin, mainly interleukin 4. Okay, so remember this particular mnemonic, 1 2 ka 4, that song, 1 2 ka 4, and this was asked. And interleukin 4 does what? It does isotype switching to what? Isotype switching to IgE. Okay, suppose IgM is there, it will start changing to what? IgE. And this particular IgE will go and sit over where? Mast cells. And in the second exposure to the allergen, those mast cells will rupture and thereby release of these particular things. That is histamine and serotonin mainly, which leads to what? Vasodilatation and bronchoconstriction. And immediate anaphylaxis can happen and death can also happen. So it's a emergency. Okay. Similarly, here only I like to tell up regarding the type 4 hypersensitivity. In the type 4 hypersensitivity, remember the modified CD4 T cells are what? They are T helper 1 cells. Okay. And T helper 1 cells release of which particular interleukin, guys? Interleukin 2. Mainly which interleukin is being released by these T helper 1 cells? Interleukin 2. And this time it goes like 4 1 ka 2. 4 1 ka 2. Okay. 1 2 ka 4. But 4 2 ka 1 it is not. It is 4 1 ka 2. So remember this particular stuff also. And Pooja is telling wonderfully well that the constant portion of heavy chain is changed in this phenomena, which is termed as isotype switching, also termed as class switching or isotype switching. And yes, in the type 4, we have the granuloma formation, as you are telling us. Okay. In the type 2, it is cytotoxic type. And type 3 is immune complex. So basically, type 2 antigen is a part of the cell against which the antibody is produced, like IgM and IgG, mostly IgG mediated stuff it is. In that, the special type is also there, antibody mediated cellular dysfunction, that is ADCD, myasthenia gravis and Graves' disease, a typical example of that. They're also termed as type 5 hypersensitivity. So whenever antigen antibody, they interact up, complements get activated, and the real damage happens by the complement. So that is one of the points. Type 3, there are immune complex formations. Okay. And it is of two types. One is antibody excess and one is antigen excess. Okay. The antibody excess, antigen excess. So that is also need to know. And there is a formation of immune complexes. Small immune complexes is a problem. They travel to the systems and they gather there and they activate the complement and damage happens. Okay. And they are immune complex mediated. So what is the changed basic difference between type 2, type 3? In one, the antigen is a part of the cell. And in this, the antigen is free. Free antigen is there in that. Okay. Important examples which you need to know, that is post-streptococcal glomerulonephritis is type 3. ARF is type 2. RH incompatibility is type 2. Okay, along with that, erythroblastosis fetalis is also type 2. All the transfusion reactions are also type 2. Okay. Important is drug-induced hemolytic anemias. They are also what? Type 2. Okay. Hyperacute graft rejection, type 2. So all these particular things you need to know regarding this particular entities or the hypersensitivities. Okay, I have in a nutshell, I've given you all the crux. In the type 4, you know, all the granular formation is there. So lapromin reaction, tuberculin test, type 1 Lapra reaction, they all are what? Type 4. Okay, they all are what? Type 4. Only one sort of allergy that is termed as contact dermatitis is type 4. Okay, otherwise mostly are what? Type 1. Okay. In what difference you want, Cave? In the type 2, type 3, na? In type 2, antigen is a part of the cell. It is fixed to that particular cell. And in the type 3, antigen is free. Okay. And there are two states. One is antigen axis and one is antibody axis. And there is formation of immune complex. And whenever antigen antibody interactions, which happens in both type 2 and type 3 also, complements are activated. And the real damage happens by the complements. Contact dermatitis is a special type of allergy by the nickel and these metal of which are artificial jewelry and all. So that is termed as contact dermatitis, mainly mediated by CD8 T cells. Okay. Now coming to this, which of the following is false about the Spalding classification? Spalding classification, you know, guys, is what it is, like non-critical items, which are not much of a problem, like you have BP cuff, okay, those which touches you. They are also included up in classification. That's true. Semi-critical items, they are those which comes in the contact with mucous membrane. Very right. I told you semi-M, mucous membrane. Semi-critical items needs low disinfectant. No. Low disinfectant is only for whom? It is for the non-critical items. And for this, you have to have what? High-level disinfection. HLD. High-level disinfection is there for this particular one. And for the cardiac catheters, obviously that is the high-level disinfection which is being needed because it comes in the critical items. Cardiac catheter is coming what? Critical items. So, which enter the sterile sites. That is termed as critical item. Semi-critical, which touches the mucous membrane. But remember, for the semi also, you have to use what? HLD. High level disinfection. Okay. And here only I like to tell you some of the important biological indicators, guys. I like to tell you important biological indicators in the hot air oven. Okay. Now we do not use what? Bacillus subtilis spores. We use spores of Bacillus atrophius. We use spores of what? We use spores of Bacillus atrophius. And the similar spores of Bacillus atrophius, they are also being used in what? ETO. Ethylene or ethylene oxide. They are also being used in what? Ethylene oxide. This question came in the exam. Remember that. For ethylene oxide, the spores of Bacillus atrophius are only used. Now, in the case of autoclave, the spores of Bacillus styrothermophilus, that is also there. The spores of Bacillus styrothermophilus is there in the autoclave, and the similar spores of Bacillus styrothermophilus, they are used where, guys? They are used in the they're used in the plasma sterilization. They are used in the plasma sterilization. Okay. Then you have this particular one, Bacillus pumilus. Bacillus pumilus, that is being used for the ionizing radiation. And ionizing radiation, you know, is what, guys? Gamma rays, cosmic rays, X-rays. For them, it is pumilus. Okay, and just now we have done Bruvundimunas, dimonata or Serratia. They are being used as a spores for which particular thing? Filtration. The substances which you can't heat, you have to filter. For them, the thing is Brevundimonas diamonata spores. They are being used for the filtration. Okay. So important ones are these which you should know. Okay, which you should know. The latest is plasma sterilization, in which this question also came, that which particular gas is used. H2O2 gas that is being used in this particular one. H2O2 gas. Okay. So remember this particular stuff regarding the plasma sterilization also. Okay. Now, other than that, important is like for the blood spills and all, which particular thing is being used for the blood spills, guys? Remember sodium hypochlorite. The hypochlorous acid, HOCl, is the main thing which is playing a role of disinfectant. But it is being said that 0.5 to 1% sodium hypochlorite that is being used for the blood spills. And if both the options they give, 0.5% is a better answer. Okay. For the 0.5%, it is a better answer for this particular blood spills. Yeah, steroid is this only, plasma sterilization. Okay. So this is also important. Other than that, those particular things you already know that autoclave, we use all the culture medias are autoclaved. Okay. All the surgical sutures are autoclaved. Exceptions are there like LG, LSS, they are inspissated. Okay. Regarding the catgut sutures, they are not autoclaved. Otherwise, you have autoclave for the pipettes also. Some autoclavable pipettes they come. Certain surgical instruments are there which you can autoclave. Okay. And regarding the hot air oven, all those particular things which makes you dirty like grease, paraffin, dusting powder, they all are sterilized by what? Hot air oven. And the question which came in the NEET PG, yes, that was like for the loops, inoculating loops of microbiology, which particular thing you use? The red hot flaming. When you put that into the flame and it becomes red hot, that is the sterilizer in that particular regard. That is the sterilizer in that particular regard. Okay, so remember all these important points regarding the sterilization and disinfection. Now coming to this. A urine culture is being done on the clade media used in preference to the McConkey agar in the UTI suspected patients. Why? Because it prevents the swarming of Proteus. This that's why we prefer clade. Clade, you know what, guys? What? Cysteine lactose electrolyte deficient. What is clade? Cysteine lactose electrolyte deficient. And why we use it preference to McConkey agar? Is it the first option? Is it promotes the growth of staph, strep2 and Candida? Yes. Waiting for your answers. You tell. What is, as per you, the answer of this particular one? Yes, please tell me. Why we prefer to do the urine culture, stool culture, or the normal urine samples on the clade rather than the McConkey agar? Answer is B, guys. Okay, it promotes the growth of Staphylococcus, Streptococcus, and even Candida. Okay, means what? That it is non-selective. And McConkey agar is moderately selective. It does not allow these fellows to grow, which are gram-positive. It allows gram-negative bacteria to grow more good. Okay, but it is not so with the clade. Clade promotes the growth of other bacteria also, and that's why we prefer that. Another important thing is it is also having bromothiamine blue as an indicator. And this also have the color change of what? If the lactose fermenters are growing in this, it is also a green color media, okay, which changes to yellow if some lactose fermenters are growing into it. And the lactose fermenters are what, guys? The lactose fermenters are E. coli, Klebsiella, Shigella soni, which is also termed as LLF. Okay, so important is it is non-selective. It allows the growth of staph, strep2 and Candida. That's why we prefer of what? We prefer of clade over the McConkey agar. So this you need to remember first of all. The second important thing is, which I like to tell up, certain screening test for UTI, which came in your exam. Certain screening test for UTI. Screening test for UTI are which one, guys? Screening test for UTI are grease nitrite test. Okay, one test is there which is termed as what? Grease nitrite test. Leukocyte esterase test. Another name is what? Leukocyte esterase test. Leukocyte esterase test. Okay, and one is catalase test. One is what? One is catalase test. And I've told you in my lectures, There is a cat. There is a cat whose name is what? Lucy. And that cat, Lucy, have made the grass wet, gila. Okay, they are the various screening tests for the UTI. And obviously, the best is the confirmation is culture. Culture on what? Clade. Why we prefer clade? Because it is non-selective. Okay, because it is non-selective. Mekonke agar is moderately selective. I should not say that it is like highly selective. It is moderately selective. Okay. So remember that particular point also. Fine. Now, other than that, you should have a midstream urine sample, more than 10^5 E. coli per ml of urine is termed as significant bacteria. So all those particular points also needs to be remembered. Okay. And I suppose there are no questions regarding the E. coli stuff. So from my side, I'm telling up that diarrhea E. coli, which is the most important, EHEC. O157H7. Okay, this question came in the NEET PG, O157H7. And what is this O? Somatic. What is this H? Flagellar antigen. Okay, and it leads to what in the children? HUS, hemolytic uremic syndrome. And the culture media for this EHEC is SMAC. And why we use SMAC, guys? Because it does not ferment the sorbitol. Okay, other one is what? Rainbow agar. Other one is what? Rainbow agar. And this EHEC, antrohemorrhagic E. coli, is the one which secrete up these particular toxins like VT1 and VT2. Virotoxin 1, virotoxin 2, also termed as Shiga-like toxin 1, Shiga-like toxin 2. Important is it is a exotoxin, even though EHEC is a gram-negative bacteria, but mainly secretes what? A exotoxin named as VT. VT stands for virocytotoxin, also termed as Shiga-like toxin. Shiga-like toxin 1 and Shiga-like toxin 2. These are there in this particular one. Important. EHEC, which is the most common cause of traveler's diarrhea. That is the ETEC. That is the most common cause of what? Traveler's diarrhea. This is the most common cause of what, guys? Traveler's diarrhea. And which other E. coli does the traveler's diarrhea? EAEC. This sort of a lesion, attaching, effacing lesions, they are done by what? It is done by EPEC, enteropathogenic E. coli, which does pediatric age group diarrhea also. That is termed as A/E. And what is A/E? Attaching, effacing lesions and producing what? Cup-like pedestals. Producing what? Cup-like pedestals. Okay. So this particular, definitely one question comes from the E. coli, which are diarrhegenic. So you should know diarrhegenic E. coli, definitely. Now coming to this. A fungus is there from a blood culture of a patient who traveled to the Southeast Asia. The isolated fungi produce red pigment that diffused into the media, as you can see in the picture also. The probable causative fungus is. So answer to this particular question, I think everybody should know and is knowing also, I suppose so. The answer to this particular question is what, guys? This particular question answer is C. That is Tellaromyces marnifi. What is the answer? Tellaromyces marnifi, whose previous name is what? Penicillium marnifi. Whose previous name is Penicillium marnifi, having which sort of a pigment? This sort of pigment, red pigment. And this is termed as what? It is termed as brush border conidial arrangement. Okay. Brush border conidial arrangement. And Tellaromyces marnifi is a sort of which fungus, guys? It's a sort of dimorphic fungus. It is a sort of what? A dimorphic fungus. And what is a dimorphic fungus? At 25, that particular thing is mold. I told you 25 karat gold is mold. At 37, this one is yeast. Okay. Which particular one? They are the reservoirs of Tellaromyces marnifi. The reservoir of this particular one. The reservoirs are bamboo rats. Bamboo rats are the reservoirs. They already have asked that this infection ought to happen in whom most? That is HIV positive. Producing which sort of a pigment? Brick red color pigment is there in this particular one. And it is having this brush border conidial arrangement. Okay, brush border conidial arrangement. Blastomyces dermatitis, which leads to blastomycosis. This is also a dimorphic fungus and it is having figure of 8 appearance. And in the recent INICT exam, they have asked her the various dimorphic fungus, and you can remember them by a mnemonic HSBC. This particular bank, you should try for that. Please try. Please try which particular bank services HSBC. What is H? Histoplasmosis. I'm telling the disease name. S. Sporotrichosis. B. Blastomycosis. C. Coccidioidomycosis. What is P? Paracoccidioidomycosis. And T. Telaromycosis. These are the ones which are there, and in that, the exception which were given in the INICET exam was Cryptococcus. Cryptococcus obviously is not a dimorphic fungus. Okay. Aspergillus niger, it produces black colored, blackish crust in the automycosis, and when somebody cleans up, what is coming from that? Blackish crust. Okay. And it produces black colored colonies also. Rhizopus, salt and pepper like on the SDA. I told you, rice you eat with what? Salt and pepper. Mucor, which is the brother of Rhizopus, that produces cotton woolly colonies on the SDA. Okay. And I've told you how to remember the mucus you clean of a patient with what? Cotton in your internship. Okay. So all these important things you should know, guys, and they all are being asked again and again. So remember all these important points regarding them. Fine. Coming to this, which statement is not correct about the Candida auris? Okay. Which statement is not correct regarding the Candida auris? Candida auris. Candida auris, obviously, as the name suggests, belongs to which? NCA. NCA is what? Non-Candida albicans. Non-Candida albicans. And the first option says germ tube test is positive like Candida albicans in the auris. And this is what is the answer. No, this statement is not correct. The answer of ours is A only. Okay. The answer of ours is A only. The germ tube test is not positive in the case of Candida auris. It is positive in the Candida albicans. This statement is correct. And it is positive in the Candida dubiliensis. This particular fungus, it is positive, not the Candida auris. Okay. Drug resistance is there in this? Yes. Drug resistance is observed in Candida auris, and it is found to be resistant to certain drugs. And it have caused worldwide ICU infections also, because of that, it became famous. Capability to produce biofilm? Yes. The fungus can also produce the biofilms. And it's a gram-positive budding yeast cells in gram stain. Yes, you can see the gram-positive budding yeast cells in the gram stain. So answer of ours is A. That is the Candida albicans germ tube test is not positive in Candida auris. Okay. Found to be resistant to various drugs. Capability to produce the biofilm. And it's a gram-positive budding yeast cell in the gram stain. So that is also correct statement regarding it. Okay. As such, for the Candida albicans, you should know the Reynolds-Broad phenomena, that is the germ tube test formation. That is there. Another one is chlamydospore formation on the cornmeal agar. Another important thing is regarding Candida albicans, invasive candidiasis, like when it have gone into the brain, when it have gone into the lungs, and that invasive candidiasis, we have a test on which the questions are coming again and again. And that is termed as what? Beta-1,3-glucan testing. What is the name of it? Beta-1,3-glucan testing. And for which particular mnemonic we have? We have the CAP. And in the CAP, what we have, guys? Invasive candidiasis, invasive aspergillosis, and pneumocystis zeroaceae. Pneumocystis zeroaceae. So all these particular things you should know regarding that. And as such, for the Candida albicans, we use what? Fluconazole, that is the azoles. And for these resistant types, the at most last drug is what? LAMP, liposomal amphotericin B. Like we use in Candida krusei also, which is found to be resistant to the azoles. And the final result of that is LAMP. Okay. Now coming to this, guys, a COVID-19 patient, COVID-19, coronavirus disease 19 is COVID-19. And now again, it is there with its variants like JN1, JN2, they are there. And the patient suffered from this ARDS because it has been done by what? SARS-CoV-2. And this fellow is on prolonged corticosteroid. She was initially diagnosed with rhinozygomycosis, which is having what? Blackening. Okay, blackening of the tissues as shown in the image. The microscopic examination of the black tissues revealed the infection is being caused with a fungi with aseptate and broad hyphae. This is what is the crux of the question in that. Which of the following fungus is responsible for this infection? So obviously, guys, there is no point in seeing up the options. The answer is mucor, which was wrongly told as a black fungus. Okay, this is not a black fungus. You can say it's a black fungal disease, but the black fungus, if somebody asks you, that is what? That is chromoblastomycosis causing fungi. That is pheoid fungi. They are termed as darkly pigmented one, not the mucor. Okay, it is incorrectly being told in the internet also as black fungus. It does black fungal disease. This is there. And why it does this? Because angiothrombosis is there in that, and that caused this blackening. And how we got to see this aseptate and broad say hyphae in this particular one. And suppose you take the biopsy from here. You take the tissue biopsy, nasal tissue biopsy, and you put it in 10% KOH. Okay, whenever we talk about 10% KOH, immediately the fungus should come in our mind. And it produces what? Aseptate and wide-angled hyphae. Aseptate wide-angled hyphae. That is typical of what? Typical of mucormycosis, zygomycosis, and the third name also you should know, phycomycosis. Okay. Regarding the aspergillus, this particular thing changes to what? Septate and narrow-based pudding. Okay, narrow-based, or you can say narrow angle. Okay, narrow angle is there. That is termed as what? Dichotomous branching. That is termed as what? Dichotomous branching. Important is it is septate and narrow angled. Narrow angled means acute angled. Acute angled means 45 to 60-degree angle. Okay, penicillium we already have talked about. Penicillium marnifi, also termed as Stellaromyces marnifi. And the Candida also we have talked about in the above question. Okay. Now coming like the drug of choice is lamb, liposomal amphotericin B. Now coming to this, a 24 years old patient following the frequent use of contact lenses developed corneal ulcers, shows the features of having the conjunctivitis, okay, or contact lens keratitis. Saline mount preparation of the corneal scrapping shows both cyst and trophozoite. Both are seen. What should be your probable diagnosis for this particular case? So can you tell me what is the answer of this? The answer of this particular one is what, guys? What is the answer of yours for this one? Yes. Tell me. What is the most probable diagnosis of this particular case? Yes. The answer is acanthamoeba. Acanthamoeba, which is termed as free-living amoeba. It is which sort of amoeba, guys? It's a free-living amoeba. Acanthamoeba is a free-living amoeba. Okay. And this is found in the contaminated swimming pools. And the infection of this can happen through the aerosols also. So when it happens through the aerosols, it is not the lungs. But when you are go for the bathing in a contaminated swimming pool, and you are a contact lens wearer, then this can happen. That is termed as contact lens keratitis. And contact lens keratitis is often being done by whom? Acanthamoeba. Important is the cyst and trophozoite both are observed in this particular one. When you go for even CSF examination in the case of granulomatous encephalitis, which is done by this acanthamoeba. Okay. Naegleria. This is also a free-living amoeba, and it is also termed as brain-eating amoeba. It is also termed as what? Brain-eating amoeba. And when you go for the CSF examination in the case of encephalitis, which it does, PAM, in that you only see trophozoites. So important is, even if the cases of conjunctivitis or contact lens keratitis, you can observe cyst and trophozoite both. Even in the granulomatous encephalitis, which is being done by acanthamoeba, in that also both. But in the case of Naegleria, you can only see what? Trophozoites. Okay, you can only see what? Trophozoites. Trophozoites are seen up for the Naegleria fowleri. Okay, for the Naegleria fowleri. Antamoeba. Antamoeba histolytica is a intestinal amoeba. Important is the infective form. Infective form is chordonucleate cyst. Okay. And in the case of EIA, extra-intestinal amoebiasis, the most common site is what, guys? Liver, then lungs, and then brain. Okay. In the liver also, which particular lobe? Right lobe, posterior superior portion. Pus is produced, chocolate pus, and Covey sauce pus. Okay. And investigation of choice is serological, that is ELISA, EIA. As far as the GRD is concerned, binucleate cyst is the infective form, and the giardiasis happens by this particular one, having what? thick stool, bulky stools because of the fat in the stool. Tituria happens in this. It does malabsorption. Okay, it does malabsorption. Important is giardiasis can also does the traveler's diarrhea, and it is common in certain immunodeficiencies like infection of giardia, like selective IgA, and common variable immunodeficiency. Okay, all these are important points regarding all the four options. Now, coming to this, a 28-year-old commercial sex worker has a copious yellowish green frothy vaginal discharge with a fishy odor. On further examination, she also had strawberry cervix, also termed as Colpitis macularis. What is the most probable causative organism for this particular condition? So no points in guessing. The answer is what, guys? Trichomonas vaginalis. The answer is what? Trichomonas vaginalis, which leads to what? Trichomoniasis, which leads to what? Trichomoniasis. And this trichomoniasis is a sexually transmitted disease. Sexually transmitted disease. And the question which came in your exam is that partner also needs to be treated. And that's why we call it as STD. And metronidazole is to be given. Okay. Is it always a greenish stuff? It can be grayish white also. Okay. Once they have given the grayish white discharge, as according to the green one, they have given a grayish white discharge. So that is also with the trichomoniasis. This Trichomonas vaginalis is a particular organism which does not have any cyst. Another NEET PG question. Name a protozoa which does not have cyst. The answer is Trichomonas vaginalis. It have a trophozoite which have 10 flagella, 5 pairs. Okay, and 4 pairs of flagella, Giardia lamblia. Okay, which motility? Falling leaf-like motility. Okay, so that is also important. Gardnerella vaginalis. So obviously, this is the main causal agent of what? Bacterial vaginosis. And which criteria? Emsel's criteria is there for this. And the question which came for the NEET PG is, this criteria is used for what? Nugent's criteria. So Nugent's criteria is also for what, guys? Bacterial vaginosis. And the drug of choice for this also is metronidazole. In pregnancy, metronidazole. Mycoplasma hominis associates with what? NGU, non-gonococcal urethritis. Okay, less of a discharge and thin discharge. Neisseria gonorrhoeae leads to urethritis and the discharge is very thick. It looks like a semen. Okay, and this particular gonorrhea leads to what? Gonorrhea, obviously. And this particular one of having a thick discharge, urethritis in the males, mainly manifest like that, and females with the cervicitis. 50% of cases asymptomatic. And if that particular female is pregnant, then the newborn can have what? The conjunctivitis. Okay. That is also there. You know, na? That particular one. Now, the question regarding Neisseria gonorrhoeae which came in the exam is that which are the culture medias for this? So culture medias, one, everybody knows Thea Martin. And the other media which is there for this particular one is New York agar, modified New York agar. This question came in the exam. Another question which came in this particular one is that which organism is having a property of recruitment of plasmids for resistance? The answer is gonococci. Gonococci is an organism which have the property to recruit the plasmids for resistance. It recruits plasmids for resistance. Remember this point also. It recruits plasmids for resistance. Is it fine? So these all are important things regarding this particular question. Now, this one. Your patient is a 40-year-old man with occasional mild right upper abdominal discomfort. So towards the liver. On examination, liver is found to be enlarged, hepatomegaly. MRI shows up a cystic mass. Okay. On questioning, he says that he was born and raised in a rural area on a sheep ranch, came to Delhi 10 years ago. Of the following, which one is the most likely cause of this particular condition? Is it Diphyllobothrium latum, which is also known as Diphylidium latum? Is it that? Is it Echinococcus granulosus? Is it Tinea saginata? or is it Tinea solium? What is your answer for this particular question? Okay, please tell. What is the answer for this particular question? Please tell. The answer is B, Echinococcus granulosus, dog tape form. And all these guys, Diphyllobothylum letum, dog tape form, Tinea saginata, termed as beef tape form, Tinea solium, that is termed as pork tape form. So these all, they all are cystodes. Cystodes are tape-like, and this is termed as dog tape form. This particular one is termed as what, guys? It is termed as dog tape form. Okay, this is termed as dog tape form. And the definitive host in the dog tape form is dog only. Okay, and the intermediate host is sheep, and the accidental intermediate host is men. Okay, infective form, if somebody asks, is that is eggs. That is eggs. Which is the largest cystode, if somebody asks? That is Diphyllobothylum latum. It associates with which anemia? Megaloblastic anemia. Megaloblastic anemia. Okay. Tinea saginata is termed as beef tape form. And this picture came in your NEET PG. And I have, in my lectures, made you remember Tinea saginata looks like a Phillips trimmer. It exactly looks like a Phillips trimmer. It have the suckers without rostrum and hooklets. Okay. And it looks like a perfect Phillips trimmer. So Phillips trimmer was used by whom? Sangeeta, saginata. Okay. And the Tinea solium is pork tape form, and Tinea solium mainly you should focus upon what? Cysticercosis. In that also, which one? Neurocysticercosis. Most common site, subarachnoid, more than the parenchymal. And the drug of choice is what? Drug of choice is albendazole. And before giving albendazole, what you should give? Steroids. Okay. So that is what is the story of all these cystodes. One is missing. That is H. nana, Hemilopus nana, dwarf tape form. Important is the egg of that, which is having what? Polar filaments, polar thickening, and in between what? Central hooklets. That is the story of H. nana, Hemilopus nana. Also undergoes autoinfection. Also undergoes autoinfection. Now coming to this. A 35-year-old male presented in OPD with high fever, severe headache, pain behind the eyes, severe muscle and joint pain from 3 days. All of these are acceptable investigation at day 3 of the presentation except. So this is the question I think which you will able to tell easily. Okay. And what is the answer? You can tell up in the comment section. What is your answer for this? Yes. What is the answer for this? Is it NS1 antigen testing by ICT? That is, ICT means immunochromatographic test or ELISA. Viral culture or isolation in the cell line. RT-PCR or immunochromatographic test or ELISA for antibody against the dengue virus. Which is your answer for this particular question? Tell me. What is the answer? So, answer is what, guys? Answer is Ella. What is the answer? Answer is D. What is the answer? Answer is D. This antibody testing you can't do on the 3rd day because it comes on the day 5, guys. It comes on the day 5 of the fever. In the initial 2 days, NS1 comes, non-specific or non-structural NS1 antigen. Okay. And that is better to be done by what? ELISA rather than the card test. Viral culture and isolation in cell lines. Which cell lines? Mosquito cell lines. In that Aedes mosquito cell lines, you can culture that also. RT-PCR is now said to be investigation of choice actually. Okay, so that can be done because it is a RNA virus. And obviously this can't be done because it doesn't come up to 3rd day. So answer of yours should be what? Answer of yours is D. Answer of yours is D. Fine. Other than that, the important question regarding this is there is a phenomena, and the phenomena name you should know ADE. What is ADE? Antibody dependent enhancement. Antibody dependent enhancement. If there is an infection of serotype 1 followed by the serotype 2 or any other serotype also, there might be, not always, might be a enhanced infection 2nd time, which can land the individual with what? Dengue hemorrhagic fever or dengue shock syndrome or dengue shock syndrome. Is it fine? So this ADE phenomena is exclusive of what? It is exclusive of dengue. And this is the problem. The dengue vaccine of this also sought to be a failure. Okay, so that is also there. Now, Coming to this, a 45-year-old man is there, underwent kidney transplantation. And whenever the kidney transplantation word comes, two things immediately should come in your mind. One is CMV and one is BK virus. 2 months after the transplantation, that fellow developed fever and feature suggesting of bilateral diffuse interstitial pneumonitis. Bilateral diffuse interstitial pneumonitis, which of the following is the most likely etiological agent? So obviously there is no point in guessing. The answer is what? The answer here is cytomegalovirus. Okay, and this cytomegalovirus leads to what, guys? This cytomegalovirus leads to pneumonia. And this particular pneumonia is which sort of a pneumonia? Atypical pneumonia. This is a atypical pneumonia. And this happens post-transplant, post-kidney transplant mostly. It can happen post-bone marrow also. Mostly 4 weeks to 4 months. This particular time period is most vulnerable to get what? CMV pneumonia, which is a atypical pneumonia. And if it would have been BK, then what have happened? BK nephropathy. Okay, BK nephropathy, kidneys only would have involved. And in that, which cells are seen, guys? Decoy cells. Herpes simplex virus, HSV1, HSV2. HSV1 does infection above the waist. HSV2 does infection below the waist. Okay. And in HSV, you know this thing. HSV1 associates with causing what? Temporal lobe encephalitis. Mularet's meningitis. Important thing. Epstein-Barr virus. Epstein-Barr virus affects the B cells. Why B cells? Because it has receptors. Which receptors? CD21CR2. And that leads to what? Polyclonal proliferation of this particular B cells. Polyclonal proliferation of B cells, which is the cancers. Okay, so it associates with what? It associates with Hodgkin's, non-Hodgkin's, Burkitt's lymphoma, nasopharyngeal carcinoma. Okay, then you have X-linked lymphoproliferative syndrome, Duncan syndrome, tonsillar carcinoma, and the main one which you know, infectious mononucleosis, having pseudomembrane presented with sore throat. And if you give the antibiotic like ampicillin and all, the patient might be having what? Rashes all over the skin. Body, in fact. Varicella zoster virus. Varicella zoster is HHV3, human herpes virus 3, also termed as chickenpox virus. And the activation of this is termed as what? Herpes zoster. Reactivation. Herpes zoster, also termed as shingles. Okay, also termed as shingles. Another favorite question which is coming in INSCT also it came for the herpes simplex virus, HSV1 and 2, for varicella zoster virus, which smear is done? The answer is Zank smear. Zank smear is done for this particular one. Remember that. Zank smear is done for this particular one. Okay, guys? So remember this particular one, the Zank smear is done, and Zank smear is what? Multinucleated giant cells. You're able to observe Zank cells in these infections. Herpes, HSV1, HSV2, and varicella zoster also. Regarding the Epstein-Barr, this was asked in the NEET PG. Which receptors are there over the B cells? Why it is like attracted towards the B cells? CD21, CR2. Now coming to this, a 35-year-old male veterinary doctor, okay, it's seen in the emergency complaining of severe headache and vomiting. That began last night. Temperature is 40. While in the emergency room, increasingly combative, grand mal Caesar's type is observed. He is foaming at the mouth, cannot drink any liquids. So this is a hint. Analysis of the spinal fluid reveals no abnormality. No organisms are seen on the gram stain. 2 days later, despite supportive measures, that particular individual died. Pathological examination of the brain reveals eosinophilic inclusion bodies in the cytoplasm of the neurons from the hippocampus. Okay. Which of the following is the most likely etiological agent of this particular condition? So what is your answer for this question, guys? B? Why B? What is the answer of this particular question? The fellow is having eosinophilic inclusion bodies. Sufficient hint. Cannot drink any liquid. Hydrophobia is there. That fellow is a veterinary doctor. Associates with animals. Obviously, it is rabies, guys. Okay, obviously, it is rabies. And the rabies virus, you know, belongs to which family? Rhabdoviridie. Okay, subfamily Lisa. And this particular one associates with what? Two particular states. One is natural furous rabies and one is dump rabies. Dump rabies associated with vaccine virus. The natural rabies, how does it present? With the excitatory features and paralytic features. 80% excitatory, 20% paralytic. In the paralytic, only the muscle edema and fasciculation happens. Wherein the excitatory ones, all excitation, hydrophobia, aerophobia, hyperexcitability, drooling of saliva, bad condition, that is excitatory one. And you know, if rabies happens once, then it is having what, guys? 100% mortality. 100% mortality. In the antemortem diagnosis, you go for the nape of neck hair follicle on the backside, corneal smear, and you can go for the direct fluorescent antibody testing. Basically, in the antibody testing, what you try to measure up? Rabies antigen in these particular samples. Okay, in the postmortem diagnosis, the whole is fully based on Negri body demonstration. So what they are talking about here is what? Negri bodies. These are Negri bodies, and these Negri bodies are what? Intracytoplasmic eosinophilic inclusion bodies. The intracytoplasmic eosinophilic inclusion bodies termed as what? Negri bodies. Okay, and this is a postmortem finding. This is a postmortem finding. And which particular states or which particular places are there in India which does not have rabies? That is Andaman, Nicobar and Lakshadweep. They are water isolated areas and they don't have rabies. So remember that particular point also. Okay, that particular point also. And they have talked about the Negri bodies in this. And it is having 100% mortality if rabies happens. Okay, important is if it is a type of class 3 bite in which facial bites are there, the distance 3 mm per hour, 250 mm per day, if it travels upon, so you should avoid the travel. How? By giving the immunoglobulins. Human rabies immunoglobulin are preferred over the equine rabies immunoglobulin. Another stuff is regarding prions. Prions PR, remember this, they are proteins. They're proteinaceous substances, most resistant form on earth. And the prion disease, they tend to happen because PRP changes to what, guys? PRPSC. This is the abnormal folding of prion proteins, which leads to various prion diseases like which one? Kuru. CGD, that is CJD actually, Creutzfeldt-Jakob disease. Okay, Gerstmann-Straussler-Scheinkel syndrome. These all are prion diseases and they are the most resistant form on earth. They are being denatured or killed 135 for 1 hour in autoclave, or you put them into sodium hypochlorite and all that. NaOH solution can also be used for denature them. This is regarding the prions. And they are not having DNA, RNA. They are what? They are proteins, proteinaceous substances. And the major fault is PRP changed to PRPSC. Okay. Now coming to this. A 7-year-old girl is there, was well until about 3 weeks ago. She began complaining of being tired all the time. On examination, her temperature is 38. There is a tenderness below the right knee. Hemoglobin is 10.2 and WBC is 9600 with increased neutrophils. A sickle cell preparation means they have done a blood smear. In that, they observed moderate sickling tendency of the RBCs. And she was diagnosed with the osteomyelitis in this particular case. Which of the following is most likely have caused this particular condition? Okay, tell me. What is your answer for this particular question, guys? That fellow was having the features of osteomyelitis, having sickle cell anemia. So what likely is your answer for this? Tell me. Obviously, you are right. Salmonella. Okay, Salmonella. Salman is having what? Sickle cell anemia and developed this osteomyelitis. Okay, just for the remembrance sake. If you're a fan, don't be offended. So remember like this, that is Salmonella is the most common cause of osteomyelitis in sickle cell anemic ones. Otherwise, what is the answer? Staph aureus. What is the answer? Staph aureus. Okay, even Pseudomonas also does osteomyelitis. Even Pseudomonas also does osteomyelitis. Okay. Now, can you tell regarding what do you say, Staph aureus, regarding this particular one, can you tell that in this, there is one phage typing which is being done. Okay, phage typing. How many types of phages or strains are there for the staph? Yes. 23 types of Rgs are there. And 80/81 strain is the most common, which is being found in various hospitals. And the corresponding phage, obviously, will eat up which particular strain? 80/81. Okay. So this is regarding this particular question. Now, there is a patient that is 30-year-old man with a low-grade perineal pain for several weeks, who had an episode of painful ejaculation also, post-coital hematuria yesterday. He is in a long-standing monogamous relationship, traveled extensively throughout the world during the past 10 years. The urine analysis and urine culture were found to be negative. The cytological examination of the cells in the urine revealed no tumor cells because 30-year-old, so tumor is very less likely. Cystoscopy revealed several polypoid lesions and biopsy of the lesion was taken. The tissue was examined in the light microscope and eggs with terminal spine. This is what is there, the hint. Which of the following is the most likely cause of this condition? Okay. So obviously the answer is what? Answer is C. Cystosoma hematobium. Okay. Cystosoma hematobium is a fluke. You call it as what? Trematodes, which are leaf-like. Okay. And this particular one strongly associates with what? Squamous cell carcinoma of urinary bladder. Okay. It associates with what? Squamous cell carcinoma of urinary bladder. Okay. Urinary bladder, squamous cell carcinoma, this particular one, cystosoma hematobium associates. This you need to know. Important is the egg of this is being identified in the urine, and in the urine, that particular fellow is identified by what? Terminal spine. Okay, terminal spine is there in this particular one. Important here is that what is the infective form? Okay, in the case of cystosomes. So in the case of cystosomes, answer is Cercaria, guys. Okay, answer is Cercaria, and they do not have opoculated egg. They have a non-opoculated egg. Okay. In fact, these cystosomes, they have a single intermediate host, that is only snail. And this also I told up the drug of choice for all the cystodes and trematodes. For all the cystodes and trematodes, the drug of choice is what, guys? Prezi. That is praziquantel. Okay, the drug of choice is praziquantel. Obviously, exceptions are there, except the neurocysticercosis. Okay, except the Echinococcus granulosus. For them, we use L-bendazole, and there is a fluke named as Fasciola hepatica. Named as what? Fasciola hepatica, which is termed as sheep liver fluke. For that, the drug of choice is triclabendazole. For that, the drug of choice is triclabendazole. That is the C. Is the answer. That's why here. Okay. So important is this. Drug of choice of both of them is Prezi, except this. That is L-bendazole and triclabendazole, for whom NCC is neurocysticercosis, echinococcus granulosus is dog-tape form, and facial hepatica is also there, which is a fluke. Facial hepatica is termed as sheep liver fluke. Now, if I tell that these particular flukes, which we are talking about, their infective form is different. And their infective form is what, guys? Metacercaria. Okay, their infective form is what? Metacercaria. Now a question for you, all of you which are there still. Okay, tell me which particular trematode leads to blood in the sputum? Which particular trematode leads to blood in the sputum? Can you tell me? Which particular trematode is there which leads to blood in the sputum? Yes. Anybody which can tell that which one associates with blood in the sputum? Yes, tell me. That is Paragonimus westermani. Okay, which one? Paragonimus westermani. Okay, Paragonymous Westermani. So this is the one which leads to what? Which is also termed as eating up the crabs and all, that leads to this particular infection of this particular Paragonymous Westermani lung fluke. It goes to the lungs, produces cyst, leads to erosions, and thereby leads to what? Hemoptysis. Okay, that is also termed as endemic hemoptysis, and there is a reddish brown sputum which is being observed in this. Is it fine, guys? So we have this much of questions here, and in the last, I tell you one more important thing, like which can come in the exam. The drug of choice for most of the nematodes is L-bendazole. Okay, L-bendazole, except which particular one, guys? Except the slow. What is there in the slow? Slow is Strongyloides stercoralis, which is a parthenogenetic fellow. The female directly laid the eggs. And whenever we talk Strongyloides stercoralis, HIV should come in our mind. Second one is lower lova, which leads to Calabar swellings. Chrysos fly is involved in this. That is doing the loises in the eyes. O is Onchocerca volvulus. And in this, you should know regarding the onchosarcoma, subcutaneous nodules, and the night blindness, that is termed as river blindness. And the fly involved is Simulium fly, black fly. W is Wuchereria bancrofti. And Wuchereria bancrofti, if you see the microfilaria of this, in the tail tip, you will not find any nuclei. There is a ban on that. Whereas the Brugia malai, you have terminal 2 nuclei. Now, regarding these slow fellows, you should know that in the Strongyloides stercoralis, which particular drug is used? For this, ivermectin. Ivermectin. For lower lova, DEC, diethyl carbamazine. O, again, ivermectin. Okay. And for Wuchereria bancrofti, you know, for the acute filariasis, the drug of choice is DEC, diethyl carbamazine. And on this DEC, one daytime testing is also based up of Wuchereria bancrofti, in which you irritate that. And then it comes in the blood, you take the blood and produce the blood smear of it, you make the blood smear. In that, you see the tail tip. In the tail tip, if you do not see any nuclei, that is microfilaria of Wuchereria bancrofti. Otherwise, if you're seeing terminal 2 nuclei, that is the Brugia malai. That is the Brugia malai. Okay, guys. So this much is there in this particular 2020 series of NEET PG. And now your exam is being postponed. So you should know that in which particular thing. Basically, now the time is for revision. You should focus upon all these particular topics which I've told up, these particular organisms or in and around them. Definitely you should know. Along with that, you should revise, because this is a subject which can fetch you full marks. Okay. In the INICT, around 25 to 30 questions came from microbiology. Okay. And those who had done it properly, they have really scored very well, and ranks are also very good. So you should also focus upon this subject, and it needs revision. But if you have done 1 or 2 revisions proper of it, then this is what is the most loyal subject also, which will fetch you full marks even sometimes. Okay. The important is the smart study. Which particular topics you should focus upon, that is important. So focus upon all those particular topics which are important, which I have shown up also. The thing should be in and around them. Okay. Obviously, some things will be missing off in this also. For that, you can go on my YouTube channel. There is a rapid revision of the microbiology based on image. That will also cover up the full things more. Okay. So, and that will help you also to achieve up a full score in the microbiology in the shortest possible way. Okay. And the YouTube channel is by my name only, Dr. Sonu Panwar Microbiology. So you can go there and in that particular one. And Dr. Purva, thanks for here. We are listening up there. And at last, the same motivation which I give every time, because that is important, because every person, because this is postman and all, they are confused what to do, and they become complacent. So don't be. And it's all game of what? The attitude I say every time. मैं लगा रहा था उम्र परिस्थितियां बदलने में गालिब. जिस दिन मनस्थिति बदली, परिस्थितियां खुद ब खुद बदल गई. ठीक है? तो always focus on your mindset, on your attitude. If you have a winner's attitude, you will always win. And If you have a loser's one, you will lose. So don't have that. Be positive. Whatever the conditions which you can focus upon, means the things which you can't change, don't focus on them. The things which you can change, focus on them and try to produce the best results. Okay. So thank you so much, guys. And if you have any queries and all, do ask up in the Instagram channel of mine, in the this particular DocTutorials WhatsApp group. Also, I am there. You can join that. They will share the group links also in this particular one, and you can definitely see the rapid revision there based on the images. So thank you so much. Take care. Bye bye.
Thank you, sir.